Okay, guys, we're back. We're going to continue our talk about some of the cool connective tissue stuff. And again, this is a second lecture. We're going to talk about actually the glue that holds together all the extracellular matrix. So we know that cells are organized in, let me just figure out, this is actually number 1. Okay, just a moment. Let me get another one. No worries. You see, I could have given you this lecture again, you know. See how effective my thinking is right now. Got it. Okay. So here we are. So now we're going to continue again talking about this, and dimension is we're going to talk about the glue that holds cells together in the tissue. So these are known as adhesive proteins. They're the ones who ensure that all the structures in extracellular matrix are connected, and also that cells are connected to extracellular matrix. So they link together and organize extracellular matrix, and also they link cells to extracellular matrix. And we're going to talk about two important members of this family. One is fibronectin, another one is laminin. And again, we know that as extracellular matrix structures, these adhesive proteins are secreted from cells into the extracellular space. Now, fibronectin is principal adhesive protein in connective tissues. So it actually is involved in formation of tendons, for example, and holds all the extracellular matrix structures inside the tendons and other connective tissues. Because usually, it's involved in the formation of tissues that has very few cells embedded in it. The second one is laminin, which is the principal protein in epithelial tissues. You remember those basement membranes that are on the bottom? They actually are formed because and glued together, kept together, and cells are attached to the basement membrane because of the presence of this adhesive protein known as laminin. So we know that epithelial tissues line all the cavities in our body, and they actually line any space in our body and also ducts and channels through some of your organs. So fibronectin found in the connective tissue, while laminin is found in epithelial tissues, specifically attaching the cells to the basement membrane. So how do they look like? It's interesting. So these laminin and fibronectin are classified as multifunctional protein. That means that they don't bind to one thing. Think about them as glue, as anchors. They anchor other structures to them. So they contain 3 different binding domains. So they have a collagen binding, they're attached to collagen, they have proteoglycan binding domain, and they have cell binding domains. So what do? They connect collagen to proteoglycans. Remember, collagen is fibrillar structure, fibril protein. We know proteoglycans are carbohydrates that are in extracellular space, and so they connect one to the other and both of them to the cell. So we see that they play a very important role in this process. So these adhesive proteins will join, we see extracellular matrix components, and they will link these components to each other, and cells to the extracellular matrix. So let's talk about the process of cell adhesions. How do cells attach to each other? And how do cells attach to extracellular matrix? So we know that cell to extracellular matrix adhesion and cell to cell adhesion are actually mediated by presence of specific proteins in the cell wall known as membrane anchor proteins. These are the proteins that anchor across membrane structures of the cells to the extracellular matrix. They span from inside of the cell through the membrane to the outside of the cell when they anchor to extracellular matrix. So these are known as cell adhesion molecules, and a collection of cell adhesion molecules will actually form cell junctions. What are the cell junctions? These are the areas of the cell that get attached to other cells, so they ensure also attachment of cell to cell. Now, these cell adhesion molecules are also important in pathology. Why? Because they're involved in pathogenesis of viral infection. We're going to mention them. They're important in pathogenesis of cardiovascular disease, and they're also important in diseases of bone and joints. So, let me see, for some reason this thing stops working. So, let's look at this. So the next is adhesion in developing tissues. So we see the developing tissues, adhesion actually is an essential component of developing tissues. So tissues usually develop, we know, from specific precursor cell. So precursor cell is your stem cell. Okay, so tissues will develop from one stem cell that will start multiplying and making copies of itself, you know, and these cells will have similar function. But these cells have to remain attached to original cells and the cells around them to form tissues. So we see that this adhesion is very important, that the new cells remain attached to the extracellular matrix and other cells for adhesion. So growing tissue is usually in tissue, remember, you have tissue and it's growing. You have one cell that's dividing and dividing and dividing, and these cells stay attached to each other, and suddenly the entire tissue grows. That is a characteristic of the adhesion. So this process of attachment of the cells to its place of origin are known as selective adhesion. That's how tissues form. So another thing is that this selective adhesion is very important for development of very complex tissues. The other function that is associated with developing tissues is migration. So what does that mean? Think about it. If you have a precursor cell for your liver cells, and this precursor cell makes new liver cells. Liver is not only liver cells. Liver is also duct cells. Liver is also inside is going to have some of the nervation. So there's going to be nerve cells going into the liver. The liver is going to receive blood vessels. So it's another type of cells that form blood vessels. So some cells will be produced in other areas, and they will actually migrate selectively to the tissues, and they will incorporate themselves into the tissue. So this process is known as migration. So let's talk about cell junctions. These are the structures that connect two cells. So we know that all the cells are connected in tissue. If they're not, we will not have a tissue. They'll be floating all around. And this connection will enable the interaction between the cells. So we know that cells will adhere to each other through these structures that we know as cell junctions. But these cell junctions are not only points of attachment, cells to cell, but they act as barriers between the cells. They can actually prevent and act as barriers between two cells, and also they will prevent, for example, a passage of molecules between the cells all the way to the basal membrane in the tissue. Okay? So that is important for this. So cell junctions are classified according to their function. First one are tight junctions, known as zonular occludens, the one on the top. So what's the characteristic for these? These are known as tight junctions. They tightly join cells together and prevent passage of water and ions between the cells. They're very tight. The next are desmosomes, or anchoring junctures, known as macula adherens. And you see it here, third from the top, desmosomes. And desmosomes are characteristic structures on the cell membrane that will now be interconnected with each other, these two structures, two desmosomes on two cells. And this will form a macula adherens. Next is adherens junction, or zonular adherens, which are the second from the top. So what do? It's really cool. And these ones I really like. Why? Because they're cool. Okay? So the idea is that these structures couple neighboring cells to each other. Look, it's achieved by the interaction of two cytoskeletons. This is cytoskeleton of one cell. This is cytoskeleton of the other cell. And in between are transmembrane proteins, adhesion proteins that we see here. And these transmembrane proteins will touch one cytoskeleton to another cytoskeleton. Okay? So they really directly attach, indirectly through them, but directly attach two cytoskeletal structures from one cell and to the other. So these are known as adherens junctions. As you know, the cytoskeleton is skeleton inside the cells. So we know that skeleton of one cell will be attached to skeleton of other cell through adherens junctions. Next group are hemidesmosomes. These are all the way to the bottom. And hemidesmosomes are actually areas of the basal membrane from which they will enable and link cytoskeleton of intermediate filaments of basal lamina. So what does that mean? Is they will attach, you know what basal lamina is on the bottom of epithelial cells? So they will glue the epithelial cells onto the basal lamina. Okay? So they will keep them attached to the basal lamina. So those are the hemidesmosomes. and gap and communicating junctions, also known as nexus, the fourth of the top, the green one, are actually very cool. And I really like them too. It's what's a characteristic of junctions or nexus is they allow signal transfer between the cells. They're like channels. So they will carry information from one cell to the other. Cells will talk. It's like a cell phone of the cells, okay? So they will actually exchange information. So this will be achieved by the passage of small molecules or ions between the cells. Now, what's the importance of these cell junctions? They maintain integrity. If this breaks up, the tissue breaks up. And we know that these cell junctions are composed of a collection of individual cell junction molecules. So these are the cell junctions. We see here tight junctions between two cells. We see the attachment. Water cannot go through it. We see here small gap junctions. Look much, much closer. You see little channels in it. And also zonal adherence or fascia adherence, which is the area where two cells will attach to each other and their cytoskeletons will be attached. So let's talk about adhesion molecules. So they mediate selective cell-to-cell to cell-to ECM adhesion, and they're classified as transmembrane proteins. They need to span across the membrane. They need to anchor inside the cells to cytoskeleton and aside to the extracellular matrix. So they're embedded in plasma membrane. Again, they will extend through the cytoplasm, and that's important, and I'll show you why. They will go through the plasma membrane, and they will go all the way to extracellular space. And in extracellular space, they will bind to specific ligands. They will bind to adhesion molecules on other cells. They can bind to certain molecules on the surface of other cells, or they can bind directly to extracellular matrix. So there are four families of adhesion molecules I'm going to mention. These are cadherins, selectins, the immunoglobulin superfamily, and integrins. And we're going to talk about each one of them. Let's talk about cadherins. These are transmembrane linker proteins. That means that they go across the membrane all the way, and they hold cells together to maintain tissue integrity. They're very important. So they have different components. They have the extracellular component, the green one outside, where they bind to cadherin on another cell, okay? And they have intracellular component, see blue here, actually blue at the bottom, and they actually bind to linker proteins known as catenins, and these catenins will actually, blue is catenin, so the end here, green is cadherin, blue is catenins, and catenins will now bind to actin cytoskeleton. So they have external extracellular component, a green one. They have transmembrane component, and then they have intracellular component. This is this green portion. You just give me a finger inside. Then they will bind to linker proteins catenins, and catenins will enable them to bind to the actin or cytoskeleton inside the cell. So the result is this. You see here, these are cadherin dimers forming adherens junction. So cadherins from one cell attach to cadherins from other cell, and they will now inside the cell bind to catenin. Usually they'll bind to beta catenin. Beta catenin will bind to alpha catenin. This is attached to your F-actin, and they will now indirectly attach the outside of the cells and other cells with the intracellular skeleton. Very important for this is the binding of these two cadherins will require calcium. So if there is no calcium, there is no attachment between the cells. But these structures provide long-lasting adhesion that is essential for maintenance of the tissue structure. Next group are selectins. Now, selectins provide temporary cell-to-cell adhesion just for a brief period of time. They're involved in the immune system, and they play a very important immunological role. So they will mediate the migration and adhesion of police cells in your body, white blood cells, to the sites where there is a need for inflammation. There's a need to protect against the foreign agent, okay, or something wrong and foreign in your body. So they will ensure the adhesion of white blood cells to that area. There are three major selectin types. There's E, L, and P, and they're actually named by lecithin and carbohydrate binding domain, by this outside domain, okay? So we see that E-selectins have 6 consensus repeats in that domain. L-selectin has 2, and P-selectin have 9 consensus repeats in that domain. And you're going to hear more about this in your biochemistry. Again, The binding, this extracellular portion will enable the binding with extracellular carbohydrate. They can also bind to carbohydrates containing ligands or other cells. So they can actually bind to extracellular matrix, or they can mainly bind, selectins bind to the other cells. Immunoglobulin superfamily is another group that is adhesion protein and ensures cell-to-cell adhesion. So they connect one cell to another. They're called immunoglobulin superfamily. What does that mean? A big family, okay? So they're immunoglobulin. Why? Because they're very much similar by structure with immunoglobulins, antibodies in our body. And they will line the surface of the cells, and they will be involved in this process of adhesion, cellular adhesion. They will fine-tune and regulate a cell-to-cell adhesion. And we see that this is their extracellular domain, and they will, of course, be anchored inside the membrane to provide stability. Now, some immunoglobulin superfamily members will facilitate the adhesion of leukocytes, your white blood cells, to endothelial cells, cells that line inside of your blood vessels, which will now happen during stress or inflammation. So what do they bind to? They bind actually to other members of the immunoglobulin superfamily, and they find two integrins. Now, these are the integrins. Integrins are another group now of the molecule, the adhesion proteins, and their function is both cell-to-cell to cell-to-ECM adhesion, and these are, again, all mediated by integrins. So they bind cells to cell, and they also bind cells to extracellular matrix. They're homologous, transmembrane heterodimeric proteins, which means they have two subunits, heterodimeric protein. They bind to their ligands with very low affinity. These bonds are not really strong. So the binding is characterized by presence of multiple very weak interactions, and they consist of these two transmembrane proteins. In transmembrane chains, they can be of alpha and beta. Alpha has 19 types and beta has 8 types. When you combine them, you get a ton of different integrin combinations. So different chains will combine and will provide distinctive binding proteins for these integrins. Remember, there is one subtype called beta-2 subunit, which is expressed selectively by leukocytes, by white blood cells, and you're going to hear way more about this in your immunology. So here is an integrin, and we see it here. It goes through the extracellular domain, has intracellular domain, it has transmembrane domain. So where do these integrins bind? It actually depends on the situation. So in cell-to-cell attachments, integrins will bind to immunoglobulin superfamily. Remember the one previous that we said that looks very much like immunoglobulin, like immune cells on the surface of the cells? While cells to extracellular matrix attachment, they will bind to collagen and fibronectin that is all outside, forming that extracellular matrix. But this is cool. Cool is how they work. So the cell binding domain of fibronectin is an integrin binding site. So fibronectin will have a cell binding domain that normally binds to the cells, and this fibronectin, extracellular matrix structure, will bind to integrin. So extracellular domains of integrins will actually bind to the components of extracellular matrix, and they will bind by recognizing a specific group of 3 amino acids known as RGD tripeptide, which is arginine, glycine, and aspartic acid. So these, what are they going to do? They're going to find on the protein, extracellular protein, they're going to find the RDG site, and they will bind to RDG site, okay, on fibronectin or collagen. So the binding will trigger now whenever they bind from the outside integrins. This binding will send now signal all the way to intracellular domain. An intracellular domain will now change. An intracellular domain will now bind to bundles of cytoskeletal actin filaments. So what does that mean? Is that integrin bind from the outside first to an extracellular matrix, and then what's going to happen then inside of the integrin will change in conformation and will bind to the cytoskeleton. So they will actually, by doing this, they will anchor the cells in extracellular space or cells to cells. Now, why are the integrins important? They're very smart. And they're very important because they send signals. Let me explain you how. For example, there is a signal inside the cell, and this signal will now change the conformation of integrin. So integrin will not bind anymore to a specific extracellular molecule or specific cell. So from inside out you have signaling. Cell from inside can choose, theoretically, to change the conformation of integrin, and the integrin will not bind anymore to some extracellular matrix protein. Also can be opposite. We mentioned extracellular matrix protein or another cell can bind to integrins, and this will now send signals through the cells through the attachment to the actin molecule. So they can be involved in the process of signaling. They can signal changes in the cell to the outside and send signals from the outside into the cell. So these are adhesion molecules and all of their ligands. This is, you're going to need to know all this, specifically the synonyms and their I'm just joking. No, you don't. Don't send me a text, emails, Dr. D, that we need to know this. And, you know, if I'm really nasty, I'll tell you, no. You need to know cadherins, skip selectins, just learn integrins. However, focus of ICAM1 and VCAM1. Yeah. What does that mean? Now, I don't want you to hate me. I want you to hate our immunology people, because then they're going to ask you to. So, you know, but this is a really good slide if you want to use it later when you study immunology. But, so cell adhesion and diseases. Why did we learn all this stuff, Dr. D? Good question. We have headache, we hear about integrin, we hear about all this. Why are they important to us? They're important because I say so. But, I'm just joking. They're important because I need to fill my lecture. I need to get my salary. Now, the reason is they're reported clinically. Okay, I'm going to show you a little things ahead of time, so don't blame me. Dr. D teaches you ahead of time. Okay, but why? Is because you're going to learn it later. So even if they explain it to you in more detail, you say we'll learn it from Dr. D. Okay, that's the idea, and it makes me feel important. But this is it. Is actually the cell bio is connected to everything nowadays. So we talk about the cell adhesion and disease. The normal expression and function of adhesion molecules is very important to maintain normal tissues and your health. These cells adhere to each other, to extracellular matrix. They can change, signals can change, and this can result in disease process. So disease process is characterized by the disruption, alteration of normal cell to cell and cell to matrix interaction. Okay, so trafficking or movement of immune cells to the site of inflammation within a tissue can be affected. Think about it. Immune cells attach to the other cells, make sense? In order now to go to the site of inflammation. If you have problems with the adhesion molecules, they will not attach. They will continue going. Who cares? Okay? So there is a problem. They're very important. They're impaired adhesion molecule expression, so can cause interruption in this process. But there is a problem. Adhesion molecules are used by our enemies. Why? Because they can be used by viruses and other things to attach to your cells, and actually to attach and then inject viruses in them, in your cells, and cause disease. So there's different things. Also, increased expression of adhesion molecules. Remember what adhesion molecules do? They call in your immune cells. So what's going to happen if you have too much adhesion molecules in your blood vessel? Immune cells will be recruited, and they will cause autoimmune reaction. So they will cause chronic disorder or chronic disease. So those are all important. So this is what I want to teach you today briefly, is extravasation. So how do police force of our body, white blood cells, how do they stop and target the site of inflammation? And they do that by adhesion molecules. So here I am. I am a cool white blood cells who doesn't care anything. I'm just traveling and floating around, okay? I don't really want to get involved in any fight, you know? And if I was a police officer, that would be my philosophy, you know? I will hit all the donut stores. So what happens is this. So no, I'm going around and I'm not involved in any kind of activity. So suddenly, this is it. As I'm traveling down, this is the site actually of inflammation. There is a site in just in the tissue surrounding that blood vessel where there is a problem, there is a need for inflammation, there is a foreign body or attack. Okay. So what happens is this, is L-selectins on the surface of these cells will now loosely bind to the ligands, expressed ligands. These ligands get expressed when the tissue gets inflamed. So endothelial cells, cells that line the inside of your blood vessels, will express P-selectins and E-selectins, okay? And you are a leukocyte, and you have your L-selectin with you. That's your flashlight, okay? So what happens is, the moment the white blood cells pass that area, the L-selectins will loosely attach to P-selectins and E-selectins on the surface. You're going to get grabbed for your flashlight and pushed towards that area, okay? You're going to attach yourself to there. And what's going to happen now? Leukocytes don't want to get involved, do you? No. But what do? They start rolling, because these are very low bonds. Okay, they're not very strong, so they'll be rolling and kind of gluing themselves tighter, but they'll be rolling on the wall of the blood vessel. Process of rolling. Now, attachment of L-selectins to P-selectins will result now for activation and expression of integrins. So leukocytes will suddenly now start popping out integrins on their surface. Okay, it's almost like an anchor protein, integrins. Okay. And these are actually caused by L-selectin, also known as Cialyl-Lewis-10. I just give you another name for L-selectin. It's called Cialyl-Lewis-10. Some of the people in immunology will like to use that term to confuse you. So, integrin is now expressed because L-selectins bind to P and E-selectins. Now, integrins, as it rolls, will attach to immunoglobulin-like adhesion molecules there. And these are known as ICAMS1 and VCAMS1. Okay? Remember those immunoglobulin stuff that we expressed, that mentioned, that look like immune superfamily members? Okay. They will attach that. Now they will get stuck. So integrins will attach to them, and the leukocytes will stop there. Okay? Now they're stopped and held at the area of inflammation. Kind of cool. Now what they're going to do is they will now squeeze between the cells binding to receptors on the side of the cells called an PCAM1. So PCAM1s are receptors on the sides of the cells. And look, like these leukocytes are awesome. Why? Because they act as like amoeba. They will change their shape and they will squeeze through like a Terminator 2, I think. So what does it do? It goes into the tissue, does it? So that is called as diapedesis. And diapedesis is followed by extravasation, which means the entry of leukocytes into the tissue. And there, they're going to do their magic. Okay? So that is the characteristic process of extravasation. So these are the steps. Boom, slow rolling. You remember why. What do we have? E-selectins. We have selectins bind to P-selectins and E-selectins. L-selectins bind to P-selectins and E-selectins. They're rolling. And eventually they express integrins. Integrins bind now to immunoglobulin superreceptor family, ICAM1, and they get stopped. And now they will go through PCAM1 on the sides, they will push inside. Now inside the cells, so you have slow rolling, you have adhesion, you have a straightening of that adhesion, specifically attaching to PCAM1. Then you have paracellular migration between the cells, and these, like white blood cells, will now use your scaffolding, okay, in your tissues here, fibronectin and fibrin. They will attach to this scaffold and use that scaffolding to climb, like Tarzan. Okay? They're going to be moving towards the structure where they're going to be affecting it. Now they will release chemokines, which will now stimulate extra white blood cells. They call for reinforcements, and more white blood cells come to this region. Fatty streak formation. I want to disappoint you guys, but you have fatty streaks. Yeah. So, we all have fatty streaks. Actually, babies get fatty streaks. Okay. And the characteristic for fatty streaks is they can, but they do not have to become atherosclerosis. It's up to you. If you choose Dr. D's way, they become atherosclerosis. If you choose, you haven't met yet Dr. Martin's way, they're not going to become atherosclerosis. Okay? Why? Because the guy is on constant diets. And he's a good friend and partner of mine. He's a chair head of our sports medicine, who has made his lifelong task, and we're good friends and research partners, to make me change my lifestyle. It's not going to work that easy. That's the first thing. Is he takes me out for lunch once, and he's like, okay, and then he orders like huge salad. So you're sitting looking at that salad, you know, you're looking at the menu. Do I order a menu and look really ridiculous in front of him? You know, I'll buy like a steak, like some crazy stuff. I order salad. Worst experience of my life. So, you know, but he still talks about it, that he made me change my ways. For one time only. He doesn't know that when we hit the hotel room later, I found a local 7-Eleven and the party started. But, you know, yeah, we go to San Diego to a conference, we sit together, and his first thing is like, where does your beef come from? He's like, this is such a South California question. Where does the beef come from? Is it from this place or that place? Shut up, the guys are going to start spitting in our food. So, you know, but, you know, that's the way it is, health-wise. So, we all have fatty streaks. These are these yellow discolorations that you can find in the walls of blood vessels. These are early formation of atherosclerotic plaques, but it doesn't mean they're going to become atherosclerotic plaque. So this is early pathophysiological event of cardiovascular disease. It appears as this irregular yellow-white discoloration on the luminal surface of the artery. And what does it happen? Look, this is really cool. It's also adhesion. I'm not going to ask you all receptors here. Just what does it involve? So you have monocytes. You have first a blood vessel because you like to drink a lot of coffee and your blood pressure is really high and you have damage to endothelial lining of the blood vessels. Because of high blood pressure, some of those endothelial cells are messed up, okay? And they don't attach well to each other. So there is an injury to your endothelial cell. Now monocytes, which are immune cells, what are the monocytes? They are actually big, fat, they can turn into big, fat cookie monsters, okay? They can eat a lot of stuff when they need to. So these monocytes will travel around and say, ooh, injury, cool. So what do is they will actually pass and squeeze through into the injury under the wall of your blood vessel. So what they're going to do is now they're going to turn into macrophages, the big fat blobs that eat everything and try to destroy it. They're really important for us. Now what is it? Now under the blood vessel, you're going to have accumulation of fat. Why? Because this fat was carried in the blood and to transcytosis, everything starts accumulating under where there is a damage. It was able to go under the layer of the blood vessel. So what do? They start eating that fat, but they can't eat that much fat as Dr. D can eat. So what happens is eventually they become foam cells, these cells that are full of fat. But they don't destroy it, they get deposited there. Now these, if you stop eating fat, these foam cells will actually get reabsorbed, destroyed. But what happens is if you continue eating high fat, high blood pressure, more monocytes are coming in, you will develop atherosclerosis. That's why atherosclerosis is an immune disease. Makes sense? So now, let's talk about cancer. We know that cells are attached to each other. So what happens? And we know that this attachment is important. So impaired expression of specific adhesion molecules will lead to impairment of leukocyte trafficking to the site of infection. So what does that mean? Is you remember if these ICAMs are affected or anything else affected, leukocytes will not get attached to it. We also have abnormal expression of adhesion molecules will lead to disruption of normal tissue structure. Because if they are not attached properly, the cells will look funky. Okay? They will not attach properly to tissues and tissues itself. But pathogenesis of cancer is actually associated with the expression and function of adhesion molecules. We're going to talk about it in my last lecture for this block on Thursday with you guys. We're going to talk about pathogenesis of cancer. But what it is, cancer is associated with problems with adhesion molecules, okay? Among other things. Why is that? You learn in your pathology that most cancers are of epithelial origin. You know epithelium, the one that lines the spaces in your body. Most cancers, okay? So what is characteristic is that these cancers, and most of the cancers in the body, will have problems with E-cadherin expression. Remember, E-cadherin expression will glue cells together, okay? So what's going to happen when E-cadherin is not around? The cells will detach, okay? And these cells will travel through the body, causing metastasis. Because these are abnormal cancer cells that will now attach somewhere else and cause metastasis. So metastasis is the release of tumor cells and tumor spread. And also important thing is E-cadherin, whenever in the cells, this attachment to cells through E-cadherin will affect it, the cell signaling will be affected. So cells will not be signaling well to each other, so there's a better chance that some cells become more malignant, okay, and change and progress to more malignant state. Now let's talk about a condition, because you know I need to give you a condition so I can test you on it. So the condition here is leukocyte adhesion deficiency. It's a congenital disease, it's an inherited condition, it's autosomal recessive, defect in beta-2 subunit of integrins. So it's expressed on your leukocytes, actually CD2. So what is the characteristic of this? Is that leukocytes have an impaired ability to traffic to the sites of infection. You remember integrins. What do integrins do? Who do they attach to? Integrins, not selectins. They attach to immunoglobulin members. So what's going to happen with these leukocytes that have abnormal integrins? They will roll. Will they? They will, but they will not stop. Okay? So they will roll and they will pass the area. No, most of them will pass the area of inflammation. Okay? So now you have a problem. So these individuals can't mount a proper inflammatory response. So why is the inflammatory response important? It kills foreign stuff. It kills bacteria. It kills cells that are actually involved, affected by virus or whatever. So now you cannot get CUPs to the site. Okay? They're going away. So these individuals will have recurrent bacterial infections. Huge board question. Because they will ask you leukocyte adhesion deficiency patient and actually ask you what is affected, or they will actually go all the way to the fact is that one of the things they're going to mention is you have a child that has a lot of bacterial infections, one after the other, after the other, after the other. So you have to test them that they don't have leukocyte adhesion deficiency of LAD. So patients with LAD, sadly, do not survive beyond the age of 2. Okay? So symptoms are bacterial infection. Specifically, it's capsulated bacteria because cell immune response of cells is one that is involved in destruction of capsulated bacteria that have capsule. They will have defects in neutrophil adhesion, and they will have delay in their umbilical cord slogging. So what does that mean? Their umbilical cord will stay longer. You know, they will not fall off. Because that's also an immune reaction, immune process that will result in the production of those ostome belly buttons that tell us we're not from aliens, that we're born by mom. Okay? So you can check on everybody and say, okay, you're not an alien. But this is it. So defects in adhesion result in poor neutrophil chemotaxis, result in phagocytosis. There actually problems will be poor phagocytosis, and as well they will have neutrophilia. Now, Dr. D's question, physio, oh my God, how much I love physio, and pathophys. Why there is a neutrophilia? Why do they have a large amount of neutrophils in their blood? I want you to think of it. What do neutrophils do? They will get attached always to the area where there is inflammation. There is always inflammation somewhere in our body. You can prick your finger, there's an inflammation, okay? You can do anything. So what happens is these molecules cannot stop. They will continue rolling. So what does that mean? It means that more neutrophils will be in the blood. Overall, in your entire body, and less will be attached to tissue. Makes sense? Because they don't attach to tissue. They don't attach to endothelial wall. So you suddenly, the neutrophils, which whenever you take somebody's blood, you measure the free-floating neutrophils. You don't look for the ones that are attached to the surface. Now you suddenly have less attached. You have higher number of neutrophils in the blood. So that's why you're going to have neutrophilia in this situation. There are also associated bacterial infections, omphalitis, inflammation of the belly button. My brother was diagnosed with omphalitis, okay? My brother is a psychiatrist. He said it was the most embarrassing diagnosis he ever had in his life. So, you know, as an older brother, I enjoy mentioning that. He suffered from chronic omphalitis. Not chronic, but I like to add that. So also, there's a pneumonia. Also, they will develop gingivitis, and they will develop peritonitis or inflammation of their peritoneum. Now, pemphigus, a really nasty-looking disorder. Common on boards, common in your wards. You'll see it. So, disorder characterized by the development of blisters as a result of failed cell-to-cell adhesion. These individuals have problem with cell-to-cell adhesion between two cells. What are the cells that require most of the adhesion? Epithelial cells and skin cells. Remember, they need to attach to each other, they need to attach to basal membrane. Makes sense? So these individuals have problems specifically with skin. So pemphigus is autoimmune condition characterized by the disruption of cadherin-mediated cell adhesion. So what does that mean? These individuals develop antibodies against cadherin, their own protein. So what's going to happen? You remember cadherin will bind two cells together. So what's going to happen when your body destroys those bonds? The bond between the cells breaks apart. Okay? And characteristic for these individuals, they can develop three types of pemphigus. And pemphigus, they will have these huge blisters all over the body. And you can actually even take, there is a Nikolsky sign with pemphigus, where you can take a spatula and scrape the skin, and you can actually remove the skin. It's going to be so easy to remove it, almost like burn. Okay, so pemphigus vulgaris is the most common and characterized by only mouth sores, and you'll see people who have that mainly with mouth sores. Next is pemphigus foliaceus. Foliaceus means skin. Okay, it's less severe because it can be more easily treated. I'll tell you how. And these individuals develop crusty sores on the scalp, chest, back, and face. And then paraneoplastic pemphigus is most severe because it's associated with cancer. There are autoimmune cells that are trying to destroy cancer, but they will actually destroy your own cadherin connections, leading to condition. And there are painful sores that will appear in mouth, they will appear on lips, they will appear actually all the way into inner organs. So sores will actually affect the esophagus, sometimes all the way to the, mainly esophagus, rarely intestines. If it is, it's going to be published, okay? But they will develop, can you imagine, sores on their esophagus, okay? So this is the most serious condition. So what does it cause? We mentioned already. All forms are caused by autoantibodies that bind to the proteins in a subfamily of cadherins. So you remember those cadherins attach two cells? So these people develop autoantibodies against those cadherins. And these cadherins are actually mainly from a group of desmogleins, which are involved in the formation of adherent junctions. You remember those adherent junctions? So what's going to happen is the adherent junctions will be destroyed, desmogleins in it, that are part of the cadherins will be destroyed by autoimmune effect. Okay? So again, binding of antibodies to cadherins will interfere with their function in cell adhesion. So we know that these epithelial cells, specifically skin cells, can't stick much to each other, and they will start falling off. Now, one thing Dr. D wants to teach you is, this is a pemphigus, but this is very common mistake the students make, medical students. I did it when I was. There is another condition known as pemphigoid. So there is a pemphigus, and there is pemphigoid, which is a different thing. Why it is dangerous? Because it's very similar by words, and similar, what does it do? But it's more serious. So what is a pemphigoid? Is actually a related group of blistering condition in which autoantibodies to proteins that are located in hemidesmosome. You remember those hemidesmosomes that attach the epithelial cells to the basal membrane. So not to each other, cadherins, but actually to the basal membrane. So what's going to happen with these cells? They will lift off from the basal membrane. Okay? And when they do, this area will be full with fluid, and they will result in formation of blisters all over the body. More serious. Now, what's the therapy for pemphigus and pemphigoid, but mainly for pemphigus, is steroids. You're going to pump these poor souls with a lot of steroids. Steroids kill immune response. They will actually decrease the immune system, decrease the production of autoantibodies, and condition will improve. But they will have on and off flare-ups of their condition. Now, increased expression of cell adhesion molecules. We mentioned this. How about the condition where you have too much adhesion molecules for your leukocytes? It's a problem, is it? When you have too much adhesion molecules in your blood vessels, in a specific organ, what's going to happen? It will attract too many white blood cells. White blood cells will go into that region and activate immune response. One of the disorders that you never thought of, maybe you did, is actually asthma. Okay? So individuals with asthma will do this. They will have actually increased expression of ICAM1. You remember what ICAM1 is? Immunoglobulin superfamily member. So these cells, specifically blood vessels in their lungs, Their endothelial cells will have large amount of IKM1s, overexpressed. So what the IKM1s do, they grab the white blood cells, as they pass by, and they stimulate inflammation. So what's going to happen with individuals who have this? Is individuals who have asthma, they're chronically inflamed. Chronic inflammation will result in thickening of their smooth muscle cells of their airways. So the smooth muscle cells of their airways will going to become thicker. Airways are going to become narrower. They will produce way more mucus because they're under inflammation. So they will develop these problems. Now, one of the problems that I'm going to mention to you in a second is IKM1, because IKM1 is loved by something else, but I'm going to keep the surprise. Now, increased expression of cells, also adhesion molecules in rheumatoid arthritis. Rheumatoid arthritis is associated with formation of pannus, which is the inflamed cartilage in the joints. And synovial inflammation is actually associated with increased leukocyte adhesion. We think that blood vessel in that cartilage will have increased expression of integrin LFA1 and IKM2. And what do? They attract now autoimmune cells and have chronic inflammation. We actually think if you want to treat successfully eventually rheumatoid arthritis, and maybe you guys are going to become famous and find that out, you can actually go and very effectively work against these adhesion molecules. And if you do for that region, specifically for the joints, you might cause and heal rheumatoid arthritis, which is, as we know, autoimmune disease, cause destruction of the cartilage. Now, the last but not the least is this. Why do I hate personally, and you should too, adhesion molecules? Okay, adhesion molecules are very important. They're important in the process of adhesion of, we know the immune cells to cause the inflammation that protect our body from foreign attacks, from crazy stuff happening. Even this immune system will destroy your cancer cells. We're going to talk about it on Thursday. So those are the important functions of the immune system. However, we know that adhesion molecules are expressed in most cells of our body, specifically in epithelial cells that line spaces. Okay. But the problem is this. Viruses, have to attach to your cells in order to inject their genetic material into a cells to cause viral infection. They need to grab on something on the surface of the cell. They will actually attach, a lot of them will attach to adhesion molecules. So what they do is the viruses will actually attach to these adhesion molecules to be able in your nose, in your airway, and they will now be able to infect your cells. So very important is IKM1. It's the molecule that mediates the attachment of leukocytes to endothelial cells, but it is also a receptor by the major group of rhinoviruses, viruses for common cold. Okay, so that's where they attach. But there is another problem, guys. Now that's why I want to go back to asthma. What asthmatics have? Increased expression of IKM1. So what does that tell you? They can much easier get affected by viral condition. And when they get affected by viral condition, things go even worse. So that is the problem with them. Remember, IKM1 is, again, used to attach viruses to the cells, and people with asthma have higher amount of IKM1, so they have better chance of getting the virus infections. So if you figure out the way how to block the IKM1, you'll probably very effectively be able to block IKM1 just in your external mucosa, not all over the body, because obviously that won't be a good idea. That would locally, maybe in your nose, in your respiratory system, you'll be able to prevent rhinovirus. And that will make you a lot of money. You will help humanity, and you will pay off your student loans. So, which is the most important thing. Okay, guys? I know because my wife is still paying hers. So, and we'll be paying until they bury. And then we'll leave it to our kids and grandkids and everything else. But they'll say, Grandma was a doctor. So, but that's it. So, hang in there. That's okay. They will never give you money unless they know you're going to pay 3 times back. Talk to economists. You're a good investor. Okay, guys. Thank you very much for your attention, and see you after tomorrow. Thanks.